All right, well, this Saturday is World Blood Donor Day, and this is an event that raises awareness to the importance that donating blood, what it means to the health industry and emergency rooms. So here to talk about this really important topic with us is Dr. Candace Robinson. She's the Chief Medical Officer and Emergency Medicine Physician at Toro. Thank you so much for being here with us, Doc.
Hi, thank you for having me.
Yeah, absolutely. So when you talk about people donating blood, the way you see it in the emergency department, I mean, it is first round of medicine. You meet them at the door. They need that blood. What are you seeing?
In emergency situations in the U.S., every 1 to 2 seconds, someone needs a blood donation.
Wow.
So that puts us at about 41,000 units that we use per day.
41,000 units per day. What happens when you don't have enough of it? What does the system do to compensate for it?
When we don't have enough of it, there are times that we have to put certain protocols in place where we have to almost ration it and determine who needs it the most.
Wow.
And triage those patients who need the emergency blood to be able to survive.
Right, and so this is something that even though you are in the emergency department and you handle people in the worst case scenarios, you need transfusions in many different situations. Talk about the other scenarios where blood donation becomes so important.
It's important for emergency situations such as trauma situations, gunshot wounds, motor vehicle accidents.
Right.
There are also instances in obstetrics, postpartum hemorrhage. We've unfortunately seen a rise in transfusion rates for those who need blood products secondary to postpartum hemorrhage. There are people who need it for chronic illnesses like sickle cell.
Okay.
You know, those of that nature.
And it's so interesting to see because some of the numbers that you were talking about in the information that you sent us, 1 in 83 U.S. deliveries and transfusion rates have risen by 54% just in the last 10 years. Why? What's happening with that? And how is blood donation really saving the day in those situations?
I believe it's multifactorial. You know, we're seeing patients with more chronic illnesses. We have older patients having babies now.
Right.
There are just different things that happen across the course of the pregnancy that sometimes can create them to have the need for blood products after delivery.
That's interesting. Also, in the cancer and transplant, I think people really do understand, right? You need that backup blood. In an oncology patient, how is blood donation so important?
Oftentimes, our cancer patients do need blood products to be able to sustain and make it through their therapies.
Wow.
So having enough blood to support those patients is necessary.
And through the therapy, like we're talking
chemotherapy, and you know, some patients have low blood counts, you know, throughout the cancer itself, as well as the therapy needed to be able to help improve their cancer diagnosis.
You really don't think about these things when you hear someone being diagnosed with these illnesses that we hear a lot about, but never in the blood donation space. Talk also about how O negative, the universal blood type, all those O negative people, listen to this.
Yes.
Why is that so important?
O negative is what we consider the universal blood. So that means that we can give you blood products without knowing what your actual blood type is.
Wow.
So it gives us the opportunity to give you blood immediately without having to wait and do a type and screen to be able to make sure that we know exactly what your blood type is before we give it to you.
Awesome. Thank you, Dr. Robinson. Appreciate your time. Really important topic. And just go out there and donate blood, guys. They're in constant need for it. So thanks for
having me.